Well, welcome, Dr. Prucz. Thank you so much for coming.
Yeah, no, thanks for having me. I appreciate it.
Thank you. I know you're super busy. And so let's just jump right in.
Okay,
How did
sounds
you
good.
get into plastic surgery?
So plastic surgery. So I started with plastic surgery. I think I discovered it in medical school, actually. So
Okay.
I don't know if you know, but I'm a fourth generation engineer. So I've kind of been in a family of just engineers my entire life. So before I went to medical
Cool.
school, my family was like, you have to do engineering first. So I
Sure.
got my engineering degrees. I got two of those at Duke University. And then after I finished my engineering, I went to Johns Hopkins for medical school. And then I fell into plastic surgery because they were nice to me, to be honest. So, when
Really?
you're doing your rotations, you sort of navigate or fall into the people that they take an interest in you and you start to take an interest in them. And
Sure.
then what I really noticed about plastic surgery at the time was that it's a lot of problem solving, which is what I love to do. So as an engineer, I like to take things apart, put them back together. And that's really what plastic surgery does. So we take things apart or they come falling apart and then we
Sure.
have to put it back together. So during my time at Johns Hopkins, I just saw the coolest cases. I mean, we had, I remember one patient, for example, he had been a soldier in Iraq and
Wow.
he had a complete loss of his penis actually. So we did
Whoa.
a complete replantation or made him a new one out of the skin from his forearm. So just things
Wow.
like that. I was seeing these really just cool cases, and from there thought that it was a great specialty for me because it allowed me to work with all these different surgeons, and all
Sure.
these different people would come and say, hey, like, yeah, we need your help with this, or I need your help with this, and that's kind of followed me here to Arizona. I work with so many orthopedic surgeons, vascular surgeons, neurosurgeons, all these different people asking for my help to let them do what they want to do. And it's really
That's
cool when they come
awesome.
and they say, hey, we need you. And I say, okay, let's go do it. So I still, get to follow that engineering problem solving mindset. And then that took me into the cosmetic world. And that's what
Okay.
I really like about plastic surgery too, because it's so diverse. So, in a single day, I might do like a gunshot to the face, and then I'll go do a mommy makeover, and
Yeah.
then I'll have like a little kid with a dog bite to the arm. So like you're just kind
Wow.
of this whole gamut. The youngest patient I ever operated on was 2 days old. The oldest
Wow.
patient I ever operated on was 99. So you get the 2-year-old to the 99-year-old. You get to work on every part of the body. You get to work with a bunch of different surgeons, and you get to basically put things back together or make things better than they were. You improve the function or appearance. So
That's great.
that's how I
That's
did it. That's my long-winded
incredible.
answer to that
Yeah,
question.
no, that's so incredible. Talk to me a little bit about, going back to your patient from Iraq. I mean,
Yeah.
how are you gaining his trust?
Yeah, well, I can't. So I didn't have to gain his trust at the time because at that point I was still in training. So he was
Okay.
gaining the trust of the people I was working with. But
Sure.
now it's gaining trust is a conversation like this. To be honest, I mean,
Okay.
whenever I tell people, we talk about choosing your plastic surgeon. Number one is make sure they're certified by the American Board of Plastic Surgery.
Okay.
So the American Board of Plastic Surgery is the only recognized board in plastic surgery. There's a lot of different other ways to call yourself a cosmetic surgeon or to call yourself a plastic surgeon. You could do a weekend course, you could do a year-long fellowship, and you can get a certification at the end that says I'm a cosmetic surgeon. But
Hmm.
none of those are actually certified by the American board. To be
Wow.
American Board of Plastic Surgery, you have to do a certified training program, which is 6 years. You have to do a 300 question written exam, and you have to do an 8 hour in person oral exam. And only after you
Wow.
pass all those steps are you a certified plastic surgeon. And then basically you just have to like the person you're talking to or meeting because you're going to
Sure.
be spending a lot of time with them. So
Yeah.
it starts like this. Like I like to see everybody in person. I like to have these conversations. I like to make sure that our goals align. And I
Right.
always tell patients, well, when you're thinking about who do you want to be with, you have to like them. You have to like their staff. You have to like their office because
Sure.
you're going to be part of that for a while.
That's right.
And then I'm a normal person,
Yeah.
so I think that helps me connect a lot. So, I grew up in West Virginia, so small town. I did all sorts of jobs. My first job was actually, I was 8 years old and I had a snow shoveling company.
Oh my
So, that
gosh,
was
at
my first,
eight?
yeah. I remember my dad caught me one time with $200. I think I was 8 or 9. I can't remember, but I was sitting here counting my money, and he's like, where's this money from?"
Yeah.
And I was like, "I just shoveled a whole bunch of driveways." So,
Oh my
and that was because they
gosh.
gave me $20 a driveway back then, which was a lot of money.
Wow.
But I was cute and I was small, and I was like, "Yeah, it's
Yeah.
$20." So,
Yeah.
but from there, I did everything. I was a dishwasher, a bartender, a barback, a
Okay.
waiter, a host, a telemarketer. I mean, I've done everything. So
All of
that lets me
it.
connect really well with people.
Okay.
And I think that's another reason people trust us, like me.
Yeah.
And then, we firmly believe that it doesn't have to be scary. Like
Yeah.
surgery is serious, but it doesn't have to be scary. So, I'm
Sure.
always joking with patients, and we're always, making comments or playing. And we have a lot of people that just come visit us. I have one guy right now who is a good friend. Actually, became a friend after we have done a couple things for him, and he comes to the office every couple weeks just to kind of say hi.
Okay.
And he brought us crumble cookies last time. So
Oh, that's
yeah,
nice.
crumble cookies is like this huge thing now. Have you
Oh
noticed
yeah,
this?
my kids are totally obsessed with
Yeah,
it. Are
I
your
can't even eat
kids?
a whole cookie. I can't even eat the thing. It's too big. I eat like maybe a quarter of it, and I'm like, I'm good.
Yeah, a
Yeah.
quarter of it'll do you. And we just did a taste testing last week with my kids. I got the 6 flavors and then I cut them up into little bites and they did the taste testing and they
Yeah.
rate it from like 1 to 10. And
Yeah.
they get real technical, like 9.8
Oh,
or
I love that.
yeah.
I do those with my wife. We always like, she thinks she can tell the difference between like Diet Coke and Diet Pepsi. And I'm like, I don't think you can. So like I blind taste test her, so we play those
Yeah.
games. So.
Does she get it right?
Not usually, no.
Oh,
It's
okay.
too similar. They're really close. You have to have a refined
Yeah.
palate to be able to
Yeah.
tell Diet Coke versus Diet Pepsi.
Oh my gosh. Well, that's awesome. Yeah. And talk about that a little bit about your personal life. You've got kids, you've got a wife.
Yeah. So my wife is our social media director.
That's
So
awesome.
we work together at the practice. So we have like a mom and pop shop. We always joke about. So
Yeah.
her parents owned a mom and pop shop in Portland,
Cool.
Vancouver, Washington, and now we sort of have the same thing.
Yeah.
So she's in the office on Thursdays, greeting patients, taking photos for us. She does all the social media content. So basically, like I'm the producer and she's like the creator. So we'll
That's
have an idea
great.
and we'll work together and make it happen. We got 2 kids right now, third one on the way, as you and I
Yeah.
talked about right before this started. So
Congrats.
that's exciting. Yep. Just trying to be normal parents. So
Sure.
anytime I like to fix stuff around the house.
That's
So
great.
I drag my boys around. So they know really well. My 4-year-old is definitely an engineer. He's always like, "Oh, you need the screwdriver. You're gonna need this hammer." I'm like, "Yep, you're right."
Genetics
Yeah.
plays a
Oh,
role.
for sure. Yeah,
Yeah.
he is definitely. And then we try every weekend to go do stuff with them. So I was telling
Sure.
you, we saw Hamilton yesterday. So
That's awesome.
we've been brainwashing them all for the past 2 weeks, watching Hamilton on Disney Plus. And
You
then
will like
you
this.
will like the show. And then at the show, we just kept feeding them with candy, and they got through it. They did great. Actually, everyone kept commenting, and my wife dresses them in the cutest outfits.
I
so
love their
they were-
outfits. I saw them on social media.
Yeah, they were all bow tied out.
Yes.
Yeah.
In
so-
this heat.
Yeah, they
like,
were a big hit at the
bravo.
show. Yeah, big hit. And then we do dinners, like we like to go out to dinner, but
Okay.
we're big on no devices. So,
I love that.
we sit
That's
at the
great.
table and all of everyone always comments on how good the kids are because we're sitting there, no devices, kind of all talking and playing. And we'll
Sure.
give them blocks because they're engineers. So they like to play with their little building
Yeah.
blocks. But,
I love
it's
that.
good. It's a
That's
pretty
great.
normal life.
I love it when I see a professional who's obviously thriving professionally and then they've got their personal life. It's like you really do have it all. You've got your family life, your practice, and
Yeah.
it's just really amazing to see.
Yeah, very
So,
blessed. Yeah, things are
yeah.
great right now.
So you talked a little bit about your social media. Tell me how that's helped your practice and the growth and exposure.
Yeah. So, it's interesting. I think that most patients find us on Google, actually.
Okay.
So they find us via Google. And then I think what the social media does is I think it provides one, it's a photo gallery. So
Yeah.
it provides like a showcase for your work. It also gives people a bit of an insight into who you are because we do just kind of fun videos. You can see stuff with my
Sure.
kids. You can see stuff with me and my wife. You can see me just talking about plastic surgery. So
Yeah.
I think the role of social media has actually been to legitimize or to justify someone's search. So like
Okay.
once they kind of find me on Google, they see that I have 1,000 5-star reviews, and then they go to my
Wow.
Instagram and they're like, "Oh, okay, this guy's cool. This is his
I
gallery.
want to hang out with him.
Yeah, I want to hang
Wanna
out
have
with
a
him.
beer with him.
Exactly. Yeah. So that kind of like legitimizes things. So that's
Sure.
kind of how I see social. We don't get a ton of people directly from social. Like I have had very few people be like, "Oh, I found you on Instagram."
Sure.
Most people are like, "I found you on Google." Or the thing that really always surprises me is they'll come and see me and I'll be like, "Why did you pick me? Like, why are you here?" And I think they're gonna say, "Oh, well, you got thousands of 5-star reviews. You went to Johns Hopkins.
Yeah.
Like, you're got great reputation." No, they say you were the closest one to my house, and I'm just
What?
like, really? Like you
Oh
spend
my
more time like researching your iPhone than you did like who your surgeon's gonna be.
Yeah.
So that answer always surprises me. But it's pretty
Wow.
common still that people
Okay.
do that. They're just like, "Oh yeah," and a lot of times actually so I do a lot of botched work, so fix things that somebody else may have not done
Sure.
right.
Yeah.
And I often ask them, "Why did you go to that person?" And number one reason is they were close to my house. The number
Wow.
2 reason is my friends went to him. So those are like, or him or her.
Oh,
Those are the
okay.
like 1 or 2 reasons. And then I always ask the same question. I was like, "Well, did you check board certification?" Because a lot of times they're not board certified
Right.
when I'm getting these patients. And then sometimes they'll even tell me they had like I had a weird feeling. I didn't feel right. So I think your gut's important. So
Yeah.
I've had several be like, I didn't feel right about it. I shouldn't have done it. My gut told me not to do it.
Sure.
So
but they
listen to your gut. They still did it. Yeah.
I tell that to people too. If you're meeting with me, like obviously I want to take your injury case, but if you don't have a rapport with me and your
Exactly.
gut's telling you something is off, like you need to
Exactly.
find that person because you're essentially married to them for a while,
Yeah,
you
yeah, we're gonna be
know?
friends for a really long time. Like I see my
Yeah.
patients, I always tell them, I see my own patients personally. So, once I do surgery, you'll see me before surgery, you'll see me the day of surgery, you'll see me every week after surgery, and you'll
Okay.
see me a lot. So I hope you like me, because yeah,
Yeah, we're gonna be in
we're
this
gonna be this together for a
together.
while. Yeah, I
Yeah.
like to see my post-ops. I'm OCD, so like I have to see and have not control, but I have to know what's going on and
Sure.
have input into what's happening, because otherwise I'm just thinking about it at home anyways. So
Yeah.
I'd rather see people. It puts my mind at ease.
Yeah, that's really cool.
Yeah.
Talk about some of those cases that you've had to fix, the botched cases.
Oh, a lot. There's been an influx recently
Okay.
of patients who've had lip injections in
Mm,
like hotel rooms. So like somebody will come from, I don't want to say always from Mexico, but somebody will come from Mexico, or
sure.
somebody will come from maybe another part of the state, and
Okay.
they'll meet you at a hotel or something, and they'll do lip injections. But they're not injecting what we would inject. They're not injecting like a actual certified FDA product.
Sure.
And I've had 3 of these now where I don't even know what was injected, but their lips just get completely destroyed, basically. So,
Wow.
just real puffy lips, and you go in, you have to cut out a whole bunch of scar tissue and try
Oh,
to get things back to normal. I had a woman who had silicone injected into her butt
okay.
for an augmentation. So literally, like when I went to surgery to take that out, it looked like the silicone you find at Home Depot, like what you would take out of like one of the
Caulking
caulking
guns.
guns, and that was
Whoa.
very strange. I had recently a woman who had surgery here. She had a tummy tuck done by a surgeon here in town, but I don't think they took enough skin, and they didn't do the application, so
Mhm.
she still looked very bloated. You can actually see that on my Instagram, that kind of
Oh,
example of that
okay.
patient who, had paid all this money for this surgery and didn't
Right.
really get what she paid for. So we fixed that. Um, and those are the things I sort of refer to as botched. I also
Sure.
fix what's, just complications. And all of us have complications. Any board certified surgeon also has complications, but I don't consider that botched. I mean, within the world of surgery, things happen. So,
And I like that about you. So I have sent you a case before where
yeah,
you were like, is it perfect? It's not. But is it malpractice? It's not.
it's not. Yeah.
So, and you're just very candid and honest about that.
Yeah, things happen. I mean, things happen. I have colleagues who call me all the time and they say, "Hey, I need your help fixing this." And
Yep.
I'll do the same thing. If each of us have our own strengths, our own weaknesses. So if there's something where I don't feel like I have a complication and I don't feel like I can manage it, which is that hasn't really come up, but if it did, I know who I would call. Like I have friends, and same
Sure.
thing. I have friends who, I had a recently great, very well respected plastic surgeon here in town who they got referred a big hernia, and the patient wanted her hernia and her tummy tuck at the same
Hmm.
time, and he didn't do that, so he sent it to me.
Okay.
So I'll do it
Oh,
for
so
him.
it's
So
like one time. She's
yeah,
going to be under one time.
yeah,
You're going
one
to fix
time,
both.
big hernia repair and get a tummy tuck. Yeah. So, we have kind of that rapport, and I try to get along with as many people in our community as I can. So,
Yeah.
any plastic surgeon that ever needs help, I'll help, or I hope they would help
Sure.
me. And, we try to have a
Absolutely.
professional community.
That's great. I love that. And that's how it is. I think that people oftentimes think that just because you're in the same industry with someone that it has to be competitive or contentious. And
It
it's not
can
like
be.
that.
It
It shouldn't
can
be like
be.
that.
Yeah. Unfortunately, plastic surgery is the most contentious medical field.
Okay.
Yeah. We're not as friendly. I wish we were, but we're not quite as friendly as like the orthopedist surgeons, or like, the neurosurgeons, for example,
Right.
because we have the insurance side, but then we have the whole cash pay side.
Okay.
So, fortunately there is a little bit of that, um, drive to compete, and
Sure.
I try to I don't do that. Like I don't want to talk badly about anybody. When
It's
patients go to
good.
another person, great. If you felt better with them, great.
Yeah.
But there is a little bit of that keeps kind of plastic surgeons always a little bit on edge with each other, which
Okay.
is unfortunate. But it does happen. But there's a good core of us who, we go to our kids' birthday parties and we spend time
Oh, that's
together. And
nice.
yeah,
I like
and
that.
I always feel like Phoenix is huge, right? Like it's
Yeah,
such a big city that's only growing.
it
So
is.
like I don't feel like the infighting or like that, kind of is necessary, because I
Sure.
think there's so many people, and that everyone can be busy. There's
Right.
enough
There's
for
enough
everyone.
work for that's what we
Yeah,
say in PI, or at least I say in PI, is that Phoenix is big. The legal community, though, is still small. And
yeah,
if you kind of slight someone, it's going to come back to you.
100%,
And there's enough work for everyone. So
100%.
just go focus on the next
Yeah.
case?
And it's interesting. People fall into their niches. Like even if
Yeah.
you go to their social medias, you'll see like, a few of my friends, like they've fallen into one category, or they've done something else, or they've they made their name in something that I never even would have thought to do. So,
Sure.
there's plenty of ways that people kind of distinguish themselves. And, for
Interesting.
us, I think it's, we're very broad focused.
Yeah.
I think people come to us because we are so broadly focused that, you're getting a very well trained surgeon who does a lot of stuff.
Right.
And then we also have sort of that mom and pop feel, like, again, like the just kind of a very friendly, normal environment.
Right.
And it's funny, I actually, our office is cool. Like, our girls in our office are great. And we have patients who are like, yeah, we went to like this Scottsdale office and everybody had lip filler and large breasts and they looked like Barbie dolls and I just didn't fit in there. And then
Yeah.
we came to your office and everyone's pretty normal. I'm like, yeah,
Yeah.
that's about right. So, but they're to each their own. There's
Right.
nothing wrong with that Scottsdale office at all. Like, that's great. Like, there's a market for that.
Sure.
And if you feel fine and you feel comfortable in that place, great, go there.
Right.
I have no problem with that.
Would you say that you have a niche, or like you'd mentioned, you're more broad focused?
I'm very broad focused.
Okay.
And it's amazing sometimes when I go back and I think about what I've been doing. And I think that comes from always the first like 4 years I was out here, I just said yes to everything.
There you
I
go.
just was like, I'm going to learn everything. I'm going to do
Right.
everything. I'm going to help everybody. I'm going to help all the other doctors. And really, because I was so recon focused
Mm-hmm.
for that first 4 or 5 years, I was doing basically like 100% reconstruction.
Sure.
My like knowledge of anatomy and surgical technique
Yep.
just went through the roof. I mean, like there's just very little now that I'm like, oh, that's not comfortable. And like I always give the example, I just did a really sweet girl. I just did her rhinoplasty. She was getting married in 6 weeks or so.
Oh, wow.
She wanted to, feel and look great on the day of her wedding.
Sure.
And she was pushing it. 6 weeks is kind of pushing it.
Yeah.
But we got it done and she looks amazing. But,
That's
I
great.
knew that I could do her rhinoplasty because I had done all of this gunshots to the face and I had done all these like fractures from car
Right.
accidents, nasal stuff. So for me I was like, okay, this is very easy compared to
Sure.
this, because when you have a fresh palate, nothing's destroyed, nothing's damaged, it's easy once
Yeah.
you've done it in something that's completely messed up.
Right.
So it really kind of parlays into just feeling confident with that stuff. So she just actually left us like the best like Google review ever.
Oh, that's
So,
good.
yeah,
That's so
she was
nice.
she was so sweet. Yeah, we love her.
And she's going to have a lifetime of memories with those photos, and she feels her best.
Exactly.
And you got her there. And that's what I
Exactly.
tell people a lot of the time. So if anyone needs like a recommendation for plastic surgery, I'm like, you have to check with Dr. Prucz,
You're so
because
sweet. Thank you.
if he's under pressure and he's doing recon on people who have gunshots, who have motorcycle accidents, all these things, like when you come in there for a scheduled surgery, can you
Yeah.
imagine how wonderful it's going to be? Because he works under pressure every day.
Yeah.
So,
those stress me out more though. I think about the cosmetic patients more than the recon patients.
okay.
Because with recon, you can only make it better. I mean,
Sure.
you'd have to be pretty bad to make it worse. So
Yeah.
with cosmetic, you can make things worse. So,
Okay.
a lot of my time and like thinking about cases and like what I'm going to do. And I'm constantly iterating. So like every time I see a patient, I'm like, okay, this is what this looks like. I'm going to do it this way next time. Or
Okay.
this is what I did this time. I'm going to change it. I'm constantly doing that.
That's great.
Going to courses, reading articles, watching videos, because I always feel like, I'm always thinking about it. Like I said, I was OCD. So these things just sort of eat at my brain for a while.
Right.
If I see something I don't quite like, I'm like, okay, I'm going to do it this way next time to make
Right.
that not happen or to make this even better.
Sure. Well, I
So-
guess if someone's going to be OCD, you'd want your plastic surgery to be OCD.
It's a good thing.
Right?
So it's actually pathologic for me because
Right.
it keeps me, I'll be sitting there trying to watch Hamilton with my kids and I'll be thinking about a patient that I just did. I'll be
Okay.
running through the surgery again in my head. So,
Sure.
it's good and it's bad. It's probably like, like that whole thing, like what's your greatest weakness?
Yeah.
And your weakness is your strength.
Yeah, in the interview.
Yeah,
I'm a
like
perfectionist.
I'm an OCD.
Yeah, yeah.
So it's sort of like that. Like it's true though. Like my OCD
Right.
is one of my strengths, but it's also definitely one of my familiar like weaknesses in terms of preventing me from enjoying kind of the moment that I'm in.
Right. So that's a lot of pressure, right?
It's a lot
so
of
like,
pressure. It's a lot of pressure,
how
yeah.
are you trying to kind of just chill and do things personally for yourself so that you can come back a better plastic surgeon and give it your all?
Yeah, my wife will tell you I don't chill. I can't turn it off. Like even at home, like today before this, I was fixing the Roomba. I was doing the lawyer reports. I was going through some medical charts, looking at some images. Like I can't turn it off.
Can't
And
relax.
I can't relax. It's just
Okay.
not who I am. And
Sure.
and to be honest, the projects that I do are how I relax. You know what I
Okay.
mean? So like it's like it may seem like I'll be building a cabinet. but I like it. Like I like when like this box
Sure.
arrives from Amazon and I have to spend 2 hours putting this together
Okay.
because for me that is relaxing, I guess.
Right. It kind of takes your
Yeah.
mind off of plastics
Yeah,
for
and
a
then I
minute.
did find this game recently that I need to delete off my phone. And I'm not going
Okay,
to say
what's
what
the
game.
game?
Well, I can't say it
Yeah.
because I unless they're going to pay me and sponsor me, I'm not going to
Oh,
say.
okay, yeah.
But it's like it is taking an hour of my night, every once in a while.
Okay.
And it complete. And my wife's like, "Why do you play that?" It's like it completely disconnects me. Like
Hit his wife up, gamer. If you want to give him some sponsorship, she's the gatekeeper there.
yeah. You let me know. Let me know. I'll put your app on blast.
But I think that's actually very interesting. I can relate to this. So like oftentimes I'll have like my mom be like, "How come you're not watching the news?" Or people would be like, "How come you don't watch this lawyer like series?"
Yeah.
I just can't. Like I just
can't.
want to shut it off and I
Yeah.
want to do something fun and mindless, maybe like watch reality TV or golf or something
Exactly.
clean
Yeah.
so that I can just do something way different.
Yeah.
So, in addition to being a plastic surgeon, you're also a business owner.
Yeah.
And that's a lot.
That's actually the hardest part, I would say.
Okay, I
Yeah.
agree with that.
Yeah.
What are some of the challenges or hurdles you face as a business owner that you've had to overcome?
Well, I think so. One thing is I don't think you're ever happy with your flow. And
Yeah.
what I mean by that is there's days where we're just slammed,
Mm-hmm.
and I'm just like, oh my gosh, like what, like I can't, like this is just too much. And
Sure.
then there's other days where we're still busy, but we're not slammed. But I want to be slammed. Now I miss when I'm
Yeah.
slammed. So now, like,
Yeah.
instead of seeing 50 patients, we're seeing maybe 40 patients. And I'm like, whoa, we're so slow. Like, my company's falling apart.
Yeah.
Where's everybody?
What's happening?
It's happening. Like,
Yeah.
I can never find that balance where I'm just sort of like, this is perfect.
I know.
And that's definitely a problem. And I don't have a solution for that. I think staff is really, really hard.
I agree with
They
that.
keep a lot of that spends a lot of our time, and I'm so lucky right now. We have just an amazing staff, and I hope they all stick around.
Yeah.
But the staff comes and goes, and
Sure.
when I first started practicing, I was so scared to lose people.
Yeah.
Like I didn't want to lose anybody. I was like, no, you can't leave. I'll give you this. I'll give you.
Yeah.
And I made that mistake and learned from it.
Okay.
And I'm sort of like I kind of went with the Silicon Valley guys, and now I tell people, look, if you don't want to be here, I'll pay you to quit. So I actually incentivize people and say,
There
if you don't
you
want to be
go.
here, I'll give you this much money. Just give me this number of weeks, and you can go.
Sure.
Like I'd rather have you let me know in advance, say you're not a good fit, and go than have you just leave suddenly or these other things.
Right.
And I'm not going to try to keep you. Like
Yeah.
that was something that I had to learn the hard way because I like people. I like making people happy.
Sure,
But
same.
it doesn't work.
Yeah,
So,
that's right. If they already have one foot out the door,
Yeah.
they're not going to be fully invested in your company.
100%.
So I think that's good. I think
Yeah.
that, yeah, definitely taking that and using it in your practice is really important. I agree with the staff. You're always trying to
Always.
recruit the best talent,
So hard.
people who really believe in your vision.
Yeah.
And it's hard, because there's competitors out there, or we kind of live in that grass is greener
Yep.
world nowadays where people think it's always going to be better somewhere else. And
100%.
that's kind of hard. So I agree
and then
with that.
keeping people happy, like helping. I think it's hard. It's hard to keep staff growing. Like I'm always trying to educate. Like I want them to feel like they're growing.
Sure.
But it's hard. I mean, it's hard to be like, sometimes that role is just not that role they're good at. But you have to sort of be like, okay, like I need to figure out what makes this person tick.
Yep.
And go. And it's funny. There's people that are not motivated by money, which is
Yeah.
very fascinating to me.
Yeah.
Like you could throw all the money at them in the world, and they're just like, I'm good.
It's like a
you gotta
love
find-
language test.
It's a love language test. It's
Yeah.
a great way to put it.
Yeah.
Yeah. Yeah. And I'm awful at words of affirmation. I'm awful at it.
I feel like, you're just so immersed in the work, and probably oftentimes you're in surgery. Like, when do you
Yeah.
have time to give the words of affirmation?
Well, no, it's just my
Maybe-
wife though. Like the staff, like I'm just not good at it. I wasn't raised that way.
Sure.
Like my parents were never like,
Same.
good job. Like for
Then,
us, it was always
no.
like acts of service. Like I never got a B in my life.
Oh,
like,
okay.
And I didn't get paid to do that. I didn't get words of affirmation for doing that. It's just who I was. Like I just wanted to
Sure.
do well. And I never it never mattered to me if somebody was like, oh, good job.
Yeah.
Even my wife, she's a words of affirmation person. So she'd be
Okay.
like, you look so cute today. And I'm like, okay, thanks. Like it doesn't compute to me.
Yeah.
And I should be saying, you look beautiful, but that's just not how my mind works. And then it's hard for me. And my wife is gorgeous. You've seen my
Yeah,
wife. but
she's a beauty.
it's-
She's a beauty queen.
Yeah.
An actual beauty
She's
queen.
very pretty, but it's
Yeah.
really hard for me because I'm like, it's hard for me to be genuine about it and be like, I mean, I'm genuine about it, but it's hard for me to do it. It's be like, you look so pretty today. Because she is
Yeah.
pretty, you know what I mean? In
Yeah.
my brain, it is what it is. It's like saying the table is white. Like,
Yeah, you're
why
like,
would
we
you point that
checked
out?
this box. You're
Yeah.
gorgeous.
Yeah,
Then move on. Yeah.
Exactly. Like, I don't need to point out the table is white. The table is white. It's very clear.
Yeah.
Like, my wife is pretty. I don't need to say you're pretty. You're obviously pretty, you know? So that words of affirmation thing is hard for me.
Yeah. Well, I'll say it. She's very pretty.
She's very pretty. Yep.
And she's a beautiful pregnant woman too.
Yeah.
It's true. I think that they all have their individual love languages. Something I've kind of tried doing now as a manager in a law firm is what makes you motivated? Like, is it the little gifts? Is it the words of affirmation? And
It's hard.
everyone's so different.
I got an advantage you don't have, though.
Oh, okay.
Botox and filler.
Oh, yeah.
So we were having a recent
Okay.
issue where our phones are ringing off the hook and we weren't getting them answered. And I'm very much like, for me, customer service is huge.
Sure.
And I'm very much like, look, I want that phone answered right away. I don't care what you're doing. I don't just
Do it.
pick it up, say, hey, thank you for calling Phoenix Plastic Surgery. Can you hold 1 second?
Yeah.
So like I started cold calling, even being like, hey, like,
yeah.
you know, pick up the phones. Because to me, that's super important. So we started a competition. So the girls are in a competition now. So
Okay.
whoever picks up the phone first for the next couple weeks gets their free Botox or free filler. Yeah. So I have
That
ways to
would-
incentivize. Yeah.
Wow, that's
So the manager's got a
great.
little office board. She's checking everybody every time they pick up the phone.
I
so,
love
Yeah. So if you
that.
guys are calling and nobody's picking up, let me know.
Okay.
I'll fix it.
That's awesome. I don't think I can provide the same incentive for
Exactly.
my-
What are you going to do?
Yeah. What am I going to do?
Yeah,
If you get hurt,
you can do a gift card
that's true.
for
To
Botox.
your
Yeah,
Botox.
so there you go.
Okay.
For your
I could
Botox
do
and
that.
filler, yeah.
I could do that.
And
I
I'll give
think-
you fans and family and friends reduction there for your employees. You got
Okay,
it. Yeah.
I like it. Yeah, that's a great way. So any business owner out there who wants to
There you
incentivize their
go.
employees,
Yeah.
that's
Gift
one
cards
way
to
to
Phoenix
do
Plastic
it.
Surgery.
Yeah,
Yes, that is a
I
great
love
way to do it.
that.
I'll take it. I'll help you guys out.
That's great. When does your campaign end? When are they going to find out who the winner is?
You know, my office manager was asking me that actually last Friday, and I don't know what she decided. I try
Okay.
not to. So I'm a micromanager, but I try not to micromanage. So
Yeah.
that's another hard part about business is I sort of have a vision, and
Sure.
I think how certain way things should be done.
Right.
But sometimes you have to let people just do it,
Do their thing.
do their thing. So
But I
there's-
feel like you wouldn't be as successful and as far as you are
if you don't micro, I
if
know.
you weren't a micromanager. So
know.
it's kind of like comes with the territory.
It does, and honestly, it's for the better. I mean, that give and
Sure.
take in a relationship is important because you get something from everybody.
Right.
So I have a vision, you have a vision. Let's meet our visions. But
Yep.
staff is hard, right? Sometimes if you're doing that too much, then they feel like you're sort of not letting them do their thing
And trusting
and trusting them. Yeah.
Yeah.
So it's complicated.
It is.
Yeah,
it's
complicated.
I always say, like, everything is balanced in life. You just don't want to be too much on one side or the other. You just want
Yeah.
to be somewhere in the middle, some harmonious place. And it's hard to achieve that harmony a lot of the time. So
Yeah.
I agree. And I could totally relate to your comment where you're saying when you have like too much business, it's too much. And then when it dips just a little bit, it's
you're
not
like, "Oh, no."
enough.
No, you start freaking out.
Yeah, I've
Yeah.
kind of tried myself to be like happy when I've got the downtime. And when it's crazy, just be grateful for it. Like, you ride those waves,
Yeah.
essentially.
I need to
So,
learn how to do that. I don't know how to do that. Yeah.
Well, I've seen you ride some waves. I think that you were on a cruise ship. And
That's
you're
true. The
riding
flow rider.
waves.
That's
Yeah.
true. I love the flow rider.
Okay.
We're going on a cruise in a couple months. I love the flow rider. Yeah.
Awesome.
Yeah, that's like
Awesome.
my jam.
Yeah,
Yeah.
I'm always like, wow, he really does do it all. He's like athletic. He's the plastic surgeon. He's the family man. Like, this is great. Business owner.
Yeah,
all
I
of it.
grew up playing like a lot of sports, and like in the winter I love snowboarding and skiing. I can do both.
Oh, wow.
I switched to skiing because of my kids, but we
Okay.
go once a month to Park City during the winter because I want my kids to be able to ski. So my 4-year-old's
Sure.
already a shredder. He's amazing, and my 3-year-old's gonna be pretty good. And then that translated into this water surfing on these boats. Like,
Yeah.
it was just like a snowboard. So I was like, okay, I can
Okay.
do this. So yeah.
What do you think is easier to get kids started on?
Ooh, I love this
Snowboarding or
question.
skiing? Okay.
I got a whole philosophy here. Okay, so snowboarding is harder to learn,
Okay.
but easier to be good at.
Oh,
So
okay.
I think snowboarding takes a longer time to figure out.
Sure.
But once you know how to snowboard, you can become a very good snowboarder very quickly.
Okay.
Skiing is the opposite. I think skiing is pretty easy to learn the basics, but to be a great skier is really hard. I mean, to be
Okay.
that person going down the moguls, parallel skis, I
Yeah.
mean, that's 30 years. I mean, that's so hard to do.
So I should start now.
No, you should. Just don't go on the moguls. I don't do moguls
Don't
anymore
start
either.
now.
No, I'm done with the jump parks. I'm done. I remember when I was, I think 12 or something, I was snowboarding and I fell and I landed on both my hands and I hurt both my thumbs.
Oh my
Yeah, they're good now. I'm
gosh.
totally fine.
Yeah,
but I remember
good.
at the time being like, oh no, my God, I just hurt both my hands.
Yeah, what
So
are you gonna do?
I'm
Yeah.
done with that. No more parks, no more moguls. So now I
Yeah,
just
because now you're
take it
like
easy.
your career relies on it. You got to be
I
really,
know.
yeah,
Yeah.
very careful with that.
So I work out. Shout out to my trainer here. So his name's Warren. He's awesome. He's at Mountainside.
All right, Warren.
Yeah, Warren's a great guy. Yeah, I hope he sees this. But he makes fun of me because I wear gloves in the
Oh
gym,
yeah,
and I'm the
we
only one in the
should.
gym. But I'm the only one.
Well, you're the
And he'll
only
always point it
plastic
out.
surgeon
Yeah,
who
and he'll
does
he'll
recon.
be like, yeah, you're the only one wearing these pansy gloves. And I'm like, yeah, I gotta protect my hands though, man. Like,
Yeah,
so
if you get
I
shot
got
in the
silky smooth hands here. Yeah.
if you get shot in the face, Warren, you're gonna be singing
Yeah,
a
that's what I was
different
telling him.
song.
I know, but he always makes fun of my gloves. So
I mean, I would wear the gloves if I were you.
yeah, there, thank you.
I'm
I
glad
appreciate
you wear
that.
the gloves, doctor.
But he always points out nobody else is. I'm like, well, I gotta protect them. So
Yeah, good. Keep the gloves on. So tell me about one of the more crazy surgeries you've ever had.
crazy surgeries.
Yeah. I love this question for doctors.
I mean, I've seen a lot. So
Okay.
people ask me that, and they're like, "What's the craziest thing you've ever seen?"
Yeah.
But I've seen everything. I mean, I've seen like shotgun to the face. I've seen somebody who jumped off a bridge, broke both legs. I had to help ortho fix that.
Oh my gosh.
I've seen these crazy botched cases. We talked about. I had one lady who in South America had surgery. She's also on Instagram if you want to check her out. But I mean, breast and belly were just all over the place. So so
Wow.
that. But I think probably one of the craziest things I've ever seen was actually probably in medical school at Johns Hopkins. Somebody came in with a vase in their rectum.
No.
Yeah, so like this, I still have the X-ray, but it's like the most amazing X-ray you'll ever see. Like literally, like it's a pelvic X-ray, and there's an entire vase sitting within the pelvis, and then it curves down into the outer part. And
What?
I think I don't have any idea how they got it in there.
Oh
But I
my
do know
gosh.
things can expand. But it always reminds me. I don't know if you watch Seinfeld.
Yeah.
But there's a great Seinfeld episode, the Fasuli Jerry
Yeah,
episode,
yeah.
where the story for proctologist is always like, I have no idea how it got there. And that's the same story here. But that was a big deal. We had to like go to surgery. We had to open their abdomen because we couldn't get it back out the way it went in. So that's
How are you talking
crazy.
to this person after? Like, what are you saying to them?
That's tough,
That's
right?
a
Because they're embarrassed. They didn't want to,
yeah.
obviously they're embarrassed to be there, and you don't want to make them feel bad. And at the same time, it's clearly not like a totally normal thing.
Yeah.
So you're sort of walking this fine line where you're like, look, this happened. And actually, I've had this conversation a lot. There's a lot of times where I have to be like, hey, look, this happened. It's
Yeah.
done. We are where we are.
Let's
just
move
forget about
forward.
how we got here, and we're
Yeah.
just gonna go forward. That comes up a lot with our, the botched fixed cases that we do, and
Sure.
a lot of like the big wounds and things that we do, because we do a lot of cancer reconstruction, and
Oh,
there's
yeah.
patients who they've had some kind of cancer resected, and they had some kind of chronic wound after the cancer,
Hmm.
and they're like, I spent years doing, trying to get this healed, and I went through this and this and this and this, and I'm always like, okay, listen,
Yeah.
that's done. We're here now.
Sure.
You gave that other doctor a year. Give me like 3 months, and let's see if we can get there.
Yep,
So
yep.
that's when it comes up.
So, if anyone's interested in pursuing a career in plastic surgery, what are some of your pieces of advice that you would give them?
Yeah, medicine's tough. If I had to go back and so my children, for example,
Mm-hmm.
I don't know if I'll have them want to encourage them to do medicine. I just feel like
Okay.
the world has changed so much.
Sure.
I mean, when we were growing up,
Yeah.
grades, college, like where you went to college, where you went to medical school, like all that stuff mattered.
Mm-hmm. Yeah.
I feel like that's not quite as important anymore,
Sure.
especially with artificial intelligence, right? With AI, like a lot of the knowledge specialties and the knowledge professions, I'm not sure how important that'll be, because you'll be able to go to AI, ChatGPT, and you'll be able to
Right.
ask it. It'll instantly pull up that information. You don't need to go to your accountant, for example. It'll do your taxes.
Sure.
And so, for my kids, I'm sort of like going to probably steer them into the world of tech and be like, hey, like, if you know how to program a computer, if you know how to write an AI, a bot or something like that, Google doesn't care if you went to Johns Hopkins or if you went to community college or if you didn't go to college at all.
Sure.
They just see a person that can do what they need them to do.
Right.
So, I think that's kind of that world. But okay, if you're set on going into the world of plastic surgery,
Right, you're still deciding
it's still an
this.
exceptionally competitive field. So,
Okay.
in the world of medicine, the most competitive fields are probably plastic surgery, dermatology, ophthalmology. Those are probably like the really very competitive neurosurgery. I mean, like
Why are they so competitive?
because a lot of people want to go into them, but the spots are very limited.
Okay.
So plastic surgery programs are the spots. I think there's a couple hundred a year for the
Wow.
whole country.
Okay.
Same with dermatology. There's very limited spots for a lot of people that
Wow.
want to do those specialties. So to do that, do good in school. Obviously
Sure.
you have to do well in school. Demonstrate interest in the field. So if you want to be into plastic surgery, shadow a plastic surgeon. Spend time with them so that they can write you strong reference letters. Like
Right.
demonstrate that you have a proficiency of what you're trying to get into.
Okay.
And stay focused. I mean, that's the thing too. Like, I think a lot of people nowadays too, like I have a lot of friends who they try this and then they try this and then they try this and then they try this, and sometimes they stumble into something and it
Mm-hmm.
works out really well, but so a lot of times it doesn't. They're too going in too many directions that they can't hone their expertise in one area. So
Right.
I chose to become a plastic surgeon and hone my expertise in the field of plastics. And
Right.
sure, I do other things, but this is what I am and this is who I am.
Sure.
And a lot of people I don't think do that as much anymore.
Right.
So that's something that I think if you want to do these fields, you have to dedicate yourself to it.
Yeah. That's great advice for anyone who's interested in going into plastic surgery or any type of medicine.
Any type of yeah,
Really.
competitive fields.
It is
yeah.
competitive.
Yeah.
That's why lawyers are lawyers.
Yeah.
Let's be honest.
You're all competitive too. Competitive too.
We're not good at the sciences and the math.
But I mean,
so.
I'll ask you. I mean, like, so in my opinion, I think a lot of your PCP visits, emergency medicine visits, are going to be robots. I think you're going to go
True.
in, you're going to sit down at a screen, you're going to input your symptoms. Someone's going to come take your blood, or a robot's going to come take your blood. It's going to interpret the results. It's going to interpret the X-ray, and it's going to give you a diagnosis, tell you what to take, and send you out. So I think that's the future of medicine, at least the non-surgical medicine.
Right.
I think it'll be not in our lifetime that surgeons are replaced, but I think we'll be replaced eventually.
Okay.
But I don't think the public's quite ready for that, and the technology's not there yet,
Sure.
to be honest, but it will be.
Okay.
So I'll ask you the same thing, though, for like lawyers. Like, do you think that's
Yeah.
going to be a thing, too? Like,
I think
I know
so,
for like
too.
contracts, for example, I don't know about personal injury because you guys, every case is different, but for like contracts,
Right.
like if I need a contract, like I can go to ChatGPT and say, I need a real estate contract for this property at the blah, blah,
Yep.
blah. And
You're
then
right.
I'll probably have a lawyer review it. But
Yeah. You're right. You're right.
what do you
And
think? Yeah.
We're always talking about AI and the law and how it's here. And if you're not adopting it, you're not accepting of it, you're kind of like that guy that was still advertising the yellow pages.
Yeah.
You're not with the times. So we're already seeing it. We're seeing it with briefs. People are using ChatGPT to do all kinds of things. So it's the future. So future of medicine and future of law.
Future of everything.
Yeah.
The future of everything.
So what are the most common surgeries you do in your practice?
On the cosmetic side?
Yes.
Yeah. I do a lot of mommy makeovers. Yeah.
Okay.
So a mommy makeover, I don't know if you know what that is, but basically it's a breast procedure combined with a tummy procedure.
Okay.
So the breast procedure can be like an augmentation or a lift or a reduction, or taking out implants and doing a lift. So a lot of different things. And then the belly portion is a tummy tuck. So basically where we take out the extra skin and fix what's called a diastasis. So the most common thing I hear from moms is they work out, they eat right, but no matter what they do, they can't get rid of this pooch.
Right.
And the reason they can't is anatomical. It's not because you're not trying. It's because the muscles are supposed to sit like this, your rectus muscles. But when you were pregnant or just age, even if you never had a baby, and yes, you can have a mommy makeover even if you never had a baby, your muscles separate. You get what's called a diastasis.
Okay.
So the pooch that you're seeing is actually a separation of the muscle.
Okay.
And the only way to fix that is to go in, put the muscles back together, and you basically get like an internal corset.
Oh.
So that's a really common thing that we do. And I really like the mom population. Like, I think I'd like, because of my two kids that we talked about, like, I think I just get along with them. My wife's a mom. Like, it's just kind of that phase of life that I'm in.
Yeah.
It just makes me, I like helping, those women feel like themselves again or feel better.
Sure.
Because, I know what they've been through.
Yeah.
So that's really great. And then, we do a lot of face stuff. So I do a lot of eyelids. We talked about the rhinoplasty in that patient who's getting married, and then the facelift, neck lift. So that's sort of like my cosmetic worlds. So I sort of do basically everything again within the world of cosmetic, but those are the most common things that we're doing.
That's amazing. And for the eye,
Yeah.
what age are people coming to you
That's
on
a great
the eye?
question. Yeah. I've seen people that are too young. So, we talked a little bit about when I don't think they need it. So I'll let them know. But predominantly, I would say 40 to like 75. That's sort of like
40s.
to 75. Yeah. The 40-year-olds don't quite need as much as the 75, for example. But most of the women who are coming in the younger ages, they're talking about hooding. They don't like when and this is a makeup term for my wife. I actually don't even know what that means, but hooding when they put on their makeup.
Yeah.
So you might understand what that means. Yeah.
You're speaking my language.
Yeah. Yeah. So I'm glad. We call it blepharotosis. But anyways, or dermatochalasis. But basically, that's what the younger women, like the 40s to 50s, they don't like the hooding.
Okay.
And then they usually have a little bit of extra skin along the lower eyelids. So we're taking care of that.
Sure.
Once you kind of get into like the 60s to 70s, well, now you have a lot of extra skin here. And now you have the fat herniating through here.
Okay.
So that's where you get those like puffy eyes.
Yeah.
So in those patients, we're actually taking fat out. We're repositioning the fat. Some people get hollow over time. So you actually need to reposition the fat, not take it out.
Okay.
And that's the part of the eye procedure that we're doing there. So the eyes are awesome because I think, when you're talking to someone, you're looking at their eyes, right?
Yeah, that's the first thing.
Yeah, it's the first thing you see. And and it's amazing, like if you go to like our Instagram, the transformation that just the eye surgery has. Like there was a gentleman we posted recently And all we did was his eyes. And he still looks 5, 10 years younger. And all we did was his eyes. We didn't do a facelift. We didn't do a neck lift. We just fixed the eyes.
And what's the recovery on something like that?
Oh, it's so quick. Yeah, I love the eye procedure.
Really?
Yeah. So basically, next day you're out and about. Most people are wearing sunglasses because you got some swelling
Yeah.
and bruising, so they don't want people asking questions.
Sure.
By about a week to 2 weeks, the bruising and swelling is for most people resolved. And by 3 or 4 weeks, you're starting to really see the final, not final results, but starting to see exactly what it's going to start to
Yeah.
look like. It's a pretty straightforward, easy recovery. Mommy makeover is a little bit more of a recovery. You need to
Okay.
dedicate a little bit more time because we're working on your breast and your belly.
Okay.
So and a lot of times in the operating room, we're actually flexing you to get out that extra skin. So when you wake up and you start walking around, you're sort of walking around a little bit with a flex back.
Okay.
And that lasts about a few days to a week or so, and so you can get all the way back straight.
Okay.
But most professional women can get back to work right away. If your job's more labor intensive, you probably need a couple days off or probably a week or two off because
Sure.
we don't want anything to rip that muscle being put back together.
Oh,
So
yeah,
that
for
just sort of
sure.
depends. But we talk about that in the consultation. I always ask people like, what do you do? What do you plan to do after?
Yep.
When's a good time to do this? Those kinds of things.
Yeah, don't do it in the heat of summer, maybe, or
Summer's a great time because you're
or
inside anyways.
do it. Yeah, I was gonna
You know
say,
what, though?
depends.
Plastic surgery slows down in summer in Phoenix, I think, for 3 reasons. One is because people leave town. So that's
okay.
number one.
Same with PI.
Number two is, I think, exactly what you just hit on. People are like, I don't want to do it in the summer. And then number three is they don't want to miss out on the pool. So
Okay,
you miss out on
yeah.
the pool.
Depends.
Because if you have like a big abdominal incision, or not big, but if you have your tummy tuck incision, you can't get it wet for a few weeks.
Sure.
So they're like, well, I don't want to miss out on the pool for 3 weeks or so.
Okay.
So that's a thing for Phoenix where
Yeah.
we see a lot more face procedures, I think, in the summer than body
Okay.
procedures.
Okay.
And then in the winter, and then the rest of the year, everything's busy.
Sure.
But yeah, we definitely see more face in the summer than we do body.
Interesting.
Yeah.
It just depends on their lifestyle, what they do.
What they're doing, yeah, exactly, exactly.
Yeah.
And the heat
For
of
sure.
the heat of the Phoenix summer or
Yeah.
desert.
Yeah, we can treat it as a winter in the east where we just hibernate and no one's going to see you. So
Exactly.
you got like good time to recover.
Exactly.
So that's interesting. Because you do a lot of recon, I feel like perhaps that might teeter into the personal injury world.
Yeah, definitely. Yes.
Can you talk a little bit about that?
About
and
personal
some of-
injury?
yeah.
Yeah, I do a lot of personal injury.
Okay.
So I've been very lucky to work with great lawyers like yourself,
Awesome.
where I get a lot referrals to like review cases, reverse personal
Sure.
injury. I like the legal stuff because again, it works well with my like OCD mind.
Yeah.
Like I just love dissecting like a chart and trying to find something that somebody else might have not seen.
Right.
And when I see patients, I also let them know, hey, like you might have a case. Like if you were at your friend's house and the dog bit you, that's not your fault. Like,
Yeah.
and then I get a lot of patients where they're like, well, I don't want to sue my friend. And I'm like, well, you're not suing your friend. Like your friend has insurance. They have Allstate or they have State Farm. So like,
Sure.
when you have something happens that's not your fault, you're not responsible. So maybe you should talk to somebody. So
Right.
that's sort of, I say, go talk to you or, any number of people.
Right.
And I always tell people though, to make sure, in my experience with personal injury, at least the lawyer side of things is, make sure that they're not quick to just settle your case. Because I don't know about you, but I do see times
right.
where, patients will come in and, the lawyers will just be like, well, we just want you to set, we need this number so that we can settle this and then it's done. And I'm
Right.
always like, well, be careful with that because those people might be taking a larger percentage
Sure.
of a smaller number than
Yeah.
someone who's going to take more time with you to get a bigger number
Sure.
and take a lower percentage. So,
Yep.
that's
You're
something
right.
that comes up that I've seen.
Yeah.
And I just caution people. Same thing with doctors. Like, do your reviews, look at your people.
Sure.
You're great. Like, make sure they like you and that you seem like a trustworthy person, which you are. And
Good rapport.
yeah, and a good rapport.
Yeah, I feel like I'm always telling clients to wait for a better settlement, and they
Yeah.
want it done quickly and they want it just over with. And I'm like, just wait because
Yeah.
I know we can get more in a month or two, and wouldn't you rather have that much more money versus kind of just settling today and getting not the full value of your case. So
Yeah.
I'm glad that you also tell them that because I feel like their inclination is just to settle and just get money today,
Yeah.
So
Yeah.
yeah, that's not always the best for them.
No, absolutely not.
In law, we have ethics, and attorneys, probably contrary to mainstream, we have to be ethical. How do you walk that fine line with ethics when it comes to plastic surgery? Because you have people coming to you that want to enhance their beauty, but then sometimes, as we're seeing, people are going a little too far.
Yeah. I think that's an awesome question. I'm a serious doctor. I don't know how else to put that. So, you'll see it even on my social media. Like I'm not dancing. I'm not doing like these jokey things. Like that's just not who I
Sure.
am because for me, like what I do is a profession. And by definition, a profession is a professional. So, I do fun stuff, but I also know that I'm a resource of knowledge.
Right.
And number one thing that we do is do no harm. So the great thing about my practice is because we are so blessed to be busy, both with cosmetic and recon, I don't have to say yes. I'm not,
Okay.
my lights are on no matter what I do. So,
Right.
you know, there's a lot of times where patients will come and say, and I'll tell them, I'm like, look, you're beautiful. Like, I don't really see what you see. I think that you have, you know, my opinion is that you look great. I think that you're chasing maybe an unrealistic goal. And I might not be the person to do that and I don't think you should do it at all. And
Sure.
that's really nice to be able to say that, because there are a lot of plastic surgery offices, not necessarily here in town, but just in general,
Right.
where they have to keep their lights on. So they're always selling.
Yeah.
You know, you go in for one thing and they're like, what about this and this and this and this and this?
Oh my
And they start
gosh.
just kind of packaging all these things. And, you know, and then we have a med spa over here, so you should do this and this and this and this.
Yeah.
And we don't do any of that. Like, that's not part of what we do. I actually feel very uncomfortable when someone comes in and they're like, tell me what you see. And I'm like, oh goodness, I just had this
I was
last
gonna ask
Thursday.
you that
Yeah.
after
I just had
this.
this last Thursday. This really lovely woman came in for her eyes. And then she was like, well, what else do you see? And I was like, really? Like, you really want me to go down this road? And she's like,
hard.
yeah. She's like, tell me. And I was like, okay, well, you know. So I started going, and because I'm an engineer, I do it just by proportion. So,
Yeah.
you know, I talked about her nasal proportions. I talked about her jowls. I talked about her neck.
Yep.
So, and this was not upselling, but she came in for her eyelids. She walked out wanting eyelids, facelift, rhinoplasty,
Okay.
and a neck lift.
Wow.
And I tried to talk her out of it, actually. I was
Yeah.
kind of like, you don't need to do any of this.
Yeah.
This is not necessary, but if you want to do it, you can. So I think, you know,
Yeah.
and the exact opposite where, and I'll use my wife as an example too. She's very pretty, but there's something she doesn't like about like one part of her nose. And she's
Okay.
like, why don't you fix this? And I'm like, because it
She
doesn't need to
doesn't
be
need
fixed.
it.
Like, it
Yeah.
looks great. She's like, well, I see it. And I was like, yeah, but the rest of the world doesn't. And I have to say that to
Yeah.
people. And
Sure.
I say this to a lot of people. I say, look, you're a beautiful woman.
Sure.
What
but
everyone sees a beautiful woman. What you're seeing, 99% of the world is not seeing. They just see a beautiful woman.
Right.
So, you know, I rephrase things like that for people.
That's really good.
Yeah, and then I just don't go down that road. I'm just not going to do things that I don't think someone needs, or
Right.
their expectations aren't realistic. And, you know, I'll just very politely be like, hey, I'm probably not your guy.
Right.
Probably not your guy.
And I like that. And I really, really respect that, because as you say, there's the doctors that are like, you can do this and that and that, you know,
Yeah.
before you know, you've got a whole like package deal. And
Yeah.
it's like, you know, I love that you say no.
Yeah.
It's exactly the type of plastic surgeon you would want to have.
Yeah, honest.
So-
And again, I think it goes back to the fact that I'm an engineer. Like, I can just break it down for you in
Sure.
proportions. I can tell
Yeah.
you why I don't agree with you. You know what I mean?
Right.
You know, we talk about dorsal aesthetic lines, and we talk about the golden ratio, and we talk about all these
Yep,
things
the
that
golden ratio.
yeah, that I
Yeah.
think about and you know, OCD about and geek out about all the time.
Right.
And you know, I try to convince people, hey, you know, you look great.
Yeah.
You look great.
Yeah, well, that's good. I really respect that. I admire that. I think that more people should be like that professionally. Unfortunately, that's not the case, but that's what makes you so special,
Oh,
you know,
thanks.
because you really, truly are fair, and your motive is to help the patient,
Yeah.
and ethically you are, you know, you're not
I never
pushy.
want to hurt anybody, because
Sure.
and like when I do, and everyone has complications, they bother me more than they bother the patient. It's like,
Of
you know,
course.
like my wife will be like, what's wrong? And I'll be like, I'm just thinking about this person. You know, so
Yeah.
like, you know,
Yeah.
and it can go on, and it can go on for weeks where I'm
Sure.
just like kind of running through my mind something.
Yep.
So yeah, it's
Yeah.
important.
Well, that's good. Well, thank you so
Yeah,
much
no
for
problem. Thank
coming
you.
on and taking the time. I know you're super busy. You were on call this weekend.
Yes. Yeah. Yeah.
And you still are here.
Yeah,
And I
thanks
really
for having me. I
thank
appreciate
you.
it.
I really admire your work. I want to send anyone I can your way. I
Thank you.
trust your work. And thanks so much for taking the time.
Thank you. Appreciate
Yeah,
it.
thanks. Thank you for tuning in to Talk Legal to Me. Remember, you can listen to us everywhere you get your podcasts, including Spotify and Apple. And if you want to watch along, visit my YouTube channel at Lawyer Gordi. Until next time, stay informed, stay legal, and stay fabulous, besties.